Blessings, blessings, and more blessings. My name is Michelle King, and this is Soulful Nutrition and Wellness, where evolution is essential for growth. All my nursemates out there, I want to discuss with you all the article that I read in regards to nursing no longer being viewed as a profession. This article stems from 140 lawmakers that sent a letter urging the Department of Education, so DoED, the Department of Education, to recant on the decision that they made that nursing will no longer be a profession. Now, the reason why these lawmakers have done this is because the need for nurses is dire. The Department of Education no longer wants to see nursing as a profession because they also do not want to allow or allot the monies that has been funded toward loans so that you can pursue nursing and higher learning in nursing. So, for an example, the nurse practitioner, the physician's assistant, they no longer want to pour funds into obtaining loans for those degrees. The reason why, I'm sure, is because the need for these professions to be filled is huge. It always has been. I myself have worked in healthcare for 36 years, and it has always been a shortage of nurses. So now what they're saying, well, if there's a lesser amount of money funding for these areas of education, then the need for nurses will be astronomical if it's already short staffed. We're already short staffed in the healthcare system. So this will cause an even greater issue when it comes to having enough people to service the community, whether the community is healthy or unhealthy. There will continue to be a lack of the proper amount of people to fill these positions. But what professions they are saying that would still be considered a profession is medicine, pharmacy, dentistry, optometry, law, veterinary medicine, osteopathic medicine, podiatry, chiropractic, believe it or not, theology, and clinical psychology. Now, all those areas are super important, but those are not the positions that are going into hospitals and long-term care facilities to care for people. Those positions are not the ones that are boots on the ground when it comes to physically, mentally, emotionally caring for the patients. Yes, you do see, your physician at your doctor's offices or, at your bedside, but they come and they go. It is the nurse, it is the CNA, the certified nurse assistant that is caring for you. It is a lot of times now the nurse practitioner or advanced practice nurse that is caring for you when you go to these minute clinics and things of that nature. So again, I just want to clarify that because we got upset. I did too. We got upset when it was stated that nursing was no longer a profession, but it was also stated that a master's in social work would be no longer considered a profession. I just want to clarify the fact that you are a professional because that is your job. That is your the education that you obtain to do your job. So you are still considered a professional. This has more to do with the funding that goes toward those that are acquiring a degree as a nurse or a nurse practitioner or a physician assistant. So again, you all, we know we're not going anywhere. People always will need a nurse to care for them because we have a lot of unwell people in this country. So we are not going anywhere. Um, it, it, listen, does this mean that we no longer have to pay fees to renew our license every 2 years as nurses? Does this mean that we will no longer have to make sure that we are, obtaining our continued education, those 20 hours of continued education units that we need to make sure that we provide, for every 2 years? Does this mean that we will no longer have to do those annual modules, or getting your certifications with with ACLS and PALS and things of that nature? Does this mean that we will no longer have to do these things since we are no longer seen as a professional? I doubt it very seriously, because you are still working these jobs and you already know that these things do need to happen just so that we can make sure that we have the education that is necessary to care for our patients, because things are always evolving, things are always changing. So there will always, be a need for us to make sure that we continue our education. But not going to keep you. Just wanted you to know you are still considered a professional, regardless of what new law they pass, or what they take away, or what is given back to us. The system is just that, the system. So with that being said, continue enjoying your holiday season, and until next time, peace out.